I'm Jessica, and I'm going to be your nurse today. Can I get your name?
Kelsey Ramos.
Okay, I'm going to wash my hands, perform hand hygiene, and put on my gloves. So I'm going to get your wristband and just compare it to your chart, okay? Can I get your name again, your full name?
Kelsey Nicole Ramos.
Date of birth?
2/18/94.
MRN number?
5423.
And do you have any allergies to food, medications, tape, latex, or the environment?
No.
Okay, perfect. That matches up with the chart. My patient does not appear to be in any general distress. Can you tell me where you are?
Brandon Hospital.
And can you tell me what day it is?
July 21st, 2021.
Okay, great. So my patient is alert and oriented times 3, so it's a person, place, and time. Now I'm going to assess your IV, since this is the only equipment that you have today. So the equipment, the IV is in the place that the chart says it is. There is no erythema, there's no swelling, redness. Is there any tenderness?
No.
Okay. I'm going to flush it. It's not infiltrated, flushing great. There is no kinks in the tubing. So it all looks wonderful, which is great. You can put it away. The next thing I'm going to do is look at your hair, skin, and nails, okay? So, I'm going to inspect your hair. The hair is clean and neat. There is no abrasions, lesions, skin breakdown, rashes on the scalp. I'm going to look at all of your skin, just kind of that up. All right. Patient's skin is warm and dry. Skin turgor, there is no tinting. There does not appear to be any skin breakdown on her legs or her arms. No rashes, no swelling, nothing like that. So that all looks great. Capillary refill is less than 3 seconds. That's wonderful. Okay, so the next thing I'm going to do is look at your ears, nose, and throat, and eyes. So can I just see your ears, just the external part? All right, there is no skin breakdown, no lesions, no rashes, anything like that. Just look towards me. I'm going to have you follow my pen light. All right, and then just look forward. I'm going to shine this bright light. Okay, pupils are equal, round, reactive to light, and accommodation. I'm going to look at your sclera, which is white, and your conjunctiva, which is pink and moist. So if you can tilt your head back. There, look at the nares. There is no drainage, and the mucous membranes are moist. And if you can stick out your tongue, and just tilt your head back a little bit. The mucous membranes are pink and moist. That's great. Can you smile? My patient's face is symmetric. The next thing I'm going to assess is the respiratory system. Are you having any trouble breathing today?
No.
Okay. And my patient does not appear to be any respiratory distress. She's not using any accessory muscles. She doesn't have any labored breathing, and her breathing pattern seems regular. So I'm going to auscultate your breath sounds. So if you can just kind of face this way. And I'm just going to open up your robe a little bit, your gown, like a robe, your gown. And whenever you feel your stethoscope on your skin, just take a deep breath for me, okay? I might have to move your sports bra out of the way just a little bit.
Okay.
Okay, here we go. Wonderful. All the lobes are clear, and that sounds great. It does not look like she has an in-symptom spirometer, but if she did, I would go over how to use it, demonstrate, and have her demonstrate it to me as well, so I can make sure she's doing it effectively. The next thing I'm going to assess is her cardiac system. So to do this, I'm going to first just palpate your pulses. I'm going to start with the carotid, one hand at a time. Your radial, and your pedal. Alright, I'm going to auscultate or listen to your carotid. And the pulses were not bounding, there was no thrills, they were normal. Alright, sounds good, no bruits. I'm going to palpate your PMI, pulse, point of maximum impulse, which is the fifth intercostal space mid-clavicular line. Alright, no heaves or lifts. Next, I'm going to auscultate your heart sounds. I'm going to start with the aortic, which is the second intercostal space, right sternal border, the pulmonary or pulmonic, which is the second intercostal space, left sternal border, Erb's point, which is the third intercostal space, and that is the left sternal border, the tricuspid, which is the fourth intercostal space, the left sternal border, and lastly the mitral, which is the fifth intercostal space, mid-clavicular line. All right.
Got it.
I'm going to start with the diaphragm and then do the bell.
Okay.
So we're just going to run through those. I'm going to just kind of lower your gown a little bit.
Okay.
All right, and then I would next listen to the mitral fifth intercostal space mid-clavicular line, and then I would also do this with the bell. And then down there. Okay. Heart sounds are normal rate and rhythm, and there does not sound there's no extra heart sounds in there at all. So that all sounds great. The next thing that we're going to do is, have you had a bowel movement? When was your last bowel movement?
An hour ago.
Okay, and was it normal?
Mm-hmm.
And any complaints of nausea, vomiting, or diarrhea?
Nope.
Okay, so if I can just have you lay back.
Okay.
I'm going to lift up your gown just to expose your abdomen.
Okay.
We're going to just inspect it, and I'm just going to listen and kind of feel around, okay?
Mm-hmm.
All right, so camera can see it. Great. So patient's abdomen is symmetrical, the size is normal, and now I'm going to listen in all four quadrants for your bowel sounds. Okay. And I'm also going to listen with the bell for the aorta. And there's no bruits. Okay. If there was no bowel sounds present, then I would listen for 5 minutes in all quadrants. So now I'm going to palpate. Just let me know if there's any tenderness. I'm going to start with a light touch first. Any tenderness?
Nope.
Okay, now I'm going to do a deeper touch. Okay, so there's no tenderness, guarding, and I did not feel any masses or anything like that. You can sit up again. Okay, so when is the last time that you urinated?
About an hour ago too.
Okay, and how frequently do you usually urinate?
Like 4 to 6 times a day.
Have you noticed that you've been urinating more frequently than usual?
No.
Okay, and was there any issues last time that you urinated? Pain?
No, nothing crazy.
Okay, great. So while you're here, I'm going to monitor your eyes and nose. And I'm just going to do that by whenever you pee in the hat. Whenever you pee in the toilet, just pee in the hat, and then I'll look at that amount. Okay, so I'm going to assess your extremities now, just the strength and everything. Have you been experiencing any swelling, numbness, or tingling in any of your body parts?
No.
Okay, so I'm going to just have you hold your hands out, and if you can squeeze them, perfect. And then if you can push against my hands, all right, and then kind of try and go against me, pushing. Okay, perfect. Alrighty, so your extremities are 5 out of 5 on strength. Have you been having any pain at all lately anywhere?
No.
Okay, and I'd also get your vitals together as well, and that would be part of your assessment. So I'm going to take those, and they are all within normal limits.
Got it.
So the next thing I'm going to do before I leave is make sure that the bed is in the lowest position. The side rails that need to be up are up or down, just depending on your situation. And your call light isn't within reach. This is how you use it. You just click on these buttons, and it's right here for you.
Cool.
And all your personal belongings are within reach as well.
got it.
Is there anything else I can do for you today?
No, that was it.
Okay, well, just let me know if you need anything at all. Just push your call light, and I'll be right outside.
Thank you.
You're welcome.